Prime Minister is to address the nation on the threat of coronavirus after he meets ministers and health officials to announce measures including isolation for the elderly and vulnerable who are deemed high risk. Natasha Hayburn is a deputy manager at a care home in Littleston-on-Sea in Kent. She is concerned about her residents and by what she says is a lack of government support and guidance, and we can talk to her now. Natasha, thank you for joining us. What are your concerns?
Well, our concerns are that we've got some residents that are self-isolating and they fit the criteria, but 111 are telling us that we just have to self-isolate. We're getting no support from the GPs and they're not testing anybody. So on Friday, for example, we rang with concerns and we asked if we could test a resident because we need to know whether it's in the nursing home. And we were told no, then there is no facility to test anymore. So we don't know whether the residents do have it or they don't have it. So we're getting no support whatsoever. We're just told to self-isolate. The GPs aren't supporting, 111 aren't supporting. We've got no backup and we can't believe that they're not testing people to find out whether they do have it or not so that we can move forward with a plan of how we're dealing with people.
So in an environment where you're looking after vulnerable people, you believe you may potentially have cases of coronavirus in your midst and you're having to deal with it?
Potentially. But because we can't get any proof, we are just dealing with it on a day-to-day basis because we can't prove whether these residents do have it or not. So do we isolate the whole home? Are we isolating unnecessarily, which is not good for the residents' well-being? We're just not getting any support or help at all. It's as though they're just being forgotten. They're just leaving them, basically. And in my opinion, if you're in a care setting and you're not in NHS in an acute setting, in my opinion, we're just leaving these people to die because we've got no tools to enable us to help these residents should they develop extreme breathing difficulties, because they will not be admitted to hospital. We currently have a resident that is in hospital that did have ticked all the boxes, and we were told this morning that this resident is very unwell, but they are not testing this person because they don't test people anymore.
And why did you say that they... Sorry to interrupt. Why did you say that the people that are in the care home wouldn't be admitted to hospital? Because I was wondering, why not just send them to hospital, call 999 if you are really concerned about their health?
Because they're just saying that they have to self-isolate and there is no tool for that. There is no resource for that because the hospitals are at stretching point as well. So that's what I mean. There's no clear guidance or support from CQCs or local authority or commissioners to move forward.
How sick are these residents in your home?
They've got signs of... one of the ones he has got a dry cough. He did have a high temperature. He currently doesn't. He's the resident that's currently in hospital is quite ill, but again, we can't confirm whether they have the illness or not because the hospital aren't testing. And when we spoke to 111 on Friday about several of our residents, we were just basically told to get on with it. There's nothing they can do. You just have to self-isolate them and go from there. So I actually went to the GP surgery and asked them for help and support and for a testing kit. And they actually told me to stand back from the counter and that there's just no support out there. We're running out of sanitizer. We're running out of PPE. We're being told there's emergency supplies that are coming to the care sector. Where are they? It's just lip service from these people. We are getting no support whatsoever.
What's the hospital said to you about why they're not testing that patient?
They just don't test anymore. They're not testing anymore. That's all they keep saying. The bottom line is, in my opinion, again, it's because this individual, they're not a celebrity, they're not a politician, they're not a footballer, they're not in the profile, so they're being left, which is so unfair. Because a lot of our residents here, they do have a good quality of life. And why should they just be left? Because they're not testing people.
And what about your staff? You said that you're running out of important equipment, sanitizer. I mean, how vulnerable are your staff feeling right now?
Well, at the moment, we do have a contingency plan in place and we do have a procedure in place for staff coming in because the home isn't accepting visitors. But also with the staff, if the school closes, who's going to look after their children? That's going to cut our workforce. Then there's no backup plan for that in the care setting. There is in the NHS, but not in the care setting. And if we run out of these supplies, they said that there's an emergency supply. Well, where are they? Well, no one, and I'm not alone. There's on social media, there's care.
We have a technical issue with that. Unfortunately, we've lost Natasha Hayburn, but talking through her concerns there, obviously, about the care home that she is deputy manager at in Littleston-on-Sea in Kent. Joining us now is Peter